Greetings, good evening everyone. Welcome, welcome, welcome. My name is Chanel Porchia-Albert. I am the founder and executive director of Ancient Song Doula Services Incorporated. And we are located in Bedford-Stuyvesant, Brooklyn, and northern New Jersey. I welcome you all out here this evening to beautiful Weeksville Heritage Center. Weeksville Heritage Center, just to give you a little bit of history about the place and the space and the energy that is in this particular establishment. It was an intentional community created by free black people in 1838 by James Weeks. And so this particular area right here, right behind us, is 3 original row houses in which you can go and you can visit and you can see the way individuals lived back in 1838 and experience that and learn about the rich history of this particular area. But Weeksville as a whole has been around for a very long time, and so it's an intentional black community of black professionals, teachers, lawyers, doctors, and everyone in between. And so thank you for being here this evening and for showing up. And I want to thank Weeksville for hosting us and allowing us to have this space to be able to hold community conversation and dialogue around the Doula Certification Bill that recently passed within the Senate and Assembly. Before we get started though, can everybody stand up? So I don't know about many people, but I've been doing doula work since 2008. And there are few times where I have had the opportunity to stand in community with doulas from across the spectrum. Doulas from different organizations, white doulas, black doulas, indigenous doulas, doulas from Dona, Carriage House, doulas from Ancient Song, doulas who have been trained by DTI, doulas who have been trained by Mama Toto Village, Uzazi Village, Common Sense Childbirth, and all of the beautiful organizations that we choose to call ourselves home. I think that this is a momentous moment of solidarity, a moment where, I know that at times it can feel like you are doing this work by yourself. I know at times that it can feel like it is a silo. I know at times you can also feel like there are people who are quote unquote gatekeepers, or people who are, or the work that you are doing is not being appreciated and not seen. And so I want you to know that one, you are very valued and you are very appreciated and that you are seen. And that the people, even though you may not necessarily be getting quote unquote the accolades in public, the people that you serve every single day, you make a huge impact on their lives that is long lasting, that cures a pattern of intergenerational trauma and experiences every single day. So from me to you, I want you to know that you are seen. I want you to know that you are heard. And I want you to know that you are loved. I want you to know that people see you. And even though they may not necessarily like every post that you have, even though you may not necessarily see your name in the news, and even though you may not necessarily have a video of somebody saying what you are doing every day, people see you. People appreciate you. And that is what community is. And you need to know that every single day. And so for me, this is very important, because it is a shift. It is an opportunity for us to have a shift in the way in which we serve community. I don't think that anybody, and I said this joke the other day, I don't think that anybody decides to become a doula because they want to sit there and do a double hip squeeze for 20 hours plus, right? Or leave their house at 3 o'clock in the morning in their comfortable bed when it's freezing cold outside and it's snowing. Like, there has to be something innately within you that calls you to do the work of service. It's something. There's something that ties you to this, whether it be your lineage, whether it be someone who has imparted those services upon you yourself, that makes you say, yo, I need to do this. and I'll do it by any means necessary. And so I want to publicly say, I thank you. I thank you for the work that you do every day, and that you are seen, and that you are heard, and that you are loved. And I want you to know that. All right? I ain't tell you to sit down. We ain't done. Okay, so I need you to believe that you are seen, that you are heard, and that you are loved. And so you're going to repeat after me. You ready? I am seen. I am seen. I am heard. I am heard. I am loved. I am loved. I am seen. I am seen. I am heard. I am heard. I am loved. I am loved. I am seen. I am seen. I am heard. I am heard. I am loved. I am loved. I am seen. I am seen. I am heard. I am loved. I don't believe you. Because y'all don't seem like you really believe yourself. Right? We're going to say this one more time. I am seen. I am seen. I am heard. I am loved. I am seen. I am heard. I am loved. I am seen. I am heard. I am loved. You need to carry that with you every single day when you do this work, because if you don't do that, you won't want to do this shit any fucking more. Real talk. You won't want to do it anymore. You'll be like, yo, you'll get frustrated, you'll get burnt out, and you'll be like, why am I doing this? I could be doing so many other things and making so much more money with less stress. Right? And so I want you to know, and I want you to believe it, because you have to believe it to be able to continue to do this work every single day for someone else. You have to believe it yourself. Make sure that your cup runneth over, and it runneth over for you and for your people and for your family first. And then it can overflow into the community. You may have a seat. So I want to introduce now our policy intern, who is going to briefly walk us through the process of bills and the listening session. Can we give a round of applause for Kennedy Austin?
Hello everyone, like Chanel said, I'm Kennedy Austin, and you're also about to watch me try and juggle 3 electronics at once. So that should be fun. So I just want to welcome you all again to our conversation about Doula Bills A.364B and S3344B. Like she said, I'm Kennedy Austin, and I'm the Research and Policy Intern at Ancient Song Doula Services. And the purpose of our conversation today is to get a better understanding of Assembly Bill A.364B and S3344B, and you're going to hear those words a lot, and they're very long and complicated for me to say, so if I mess it up, just go with it. And how they came to be and their potential impacts on the birthing community. So first, I'm going to give you a brief summary of the bills, and then I'm going to provide an overview on our political education series and the community feedback thus far, and then finally, I'm going to leave you with some recommendations that our community has come up with. So last year, as you all probably know, Governor Cuomo announced the Medicaid reimbursement bill to cover doula care for those who use Medicaid regularly. This announcement was part of a larger campaign to address racial disparities in maternal mortality and morbidity in New York State, where Black women, as you also probably know, are 12 times more likely to die of pregnancy and childbirth-related complications. Assembly Bill A.364B was introduced by Assemblymember Amy Paulin on January 9th, 2019. And then exactly 1 month later, Senate Bill S3344B was sponsored by Senator Jennifer Ramos and introduced on the floor. These bills were designed to bring more structure to the Medicaid reimbursement process, stipulating that doulas covered under Medicaid must be, quote, certified doulas. So what does that mean? Under these bills, doulas must apply for certification, which is then conferred by the health commissioner after a $40 application fee, an examination and certification process specified by the state, and after one is found to be of, quote, good moral character. While these bills were created with the intention of alleviating racial disparities within maternal health and reproductive health, in our opinion, they do not fully demonstrate a complete understanding of doula care in families that utilize doula services. Therefore, we and many other doula and doula organizations wrote open letters to our communities and our legislators, urging them to take a closer look at how doulas, especially community-based doulas, work and to create legislation that considers the conditions that make doula work accessible for doulas and the communities that they serve. Open letters, as we all know, however, are nothing without organization. Many birth workers at this very moment are not totally clear in the legislative process. It's a complicated one that we aren't taught in school and that we also don't encounter on a regular basis. In order to unite doulas across the state and really harness the potential and power that we have to create change, we began a political education series to identify the concerns that we have with these bills across the state and propose recommendations for future legislation. We believe that everyone doing this work or using doula services should be informed on how policy affects their lives so that they might be able to advocate for themselves and others. The first event in the political education series was held at Ancient Song Doula Services on June 25th, 2019. And since then, there have been events in Brooklyn, Manhattan, the Bronx, Long Island, and there are many more to come, some in Queens and Syracuse, and honestly, wherever you'd like to host them, because we are encouraging everyone and everyone to be part of this process and host their own political education series to be more informed so that we can make better decisions for ourselves and others. While we're not finished with the series, those involved in the series have come up with concerns about the current legislation and recommendations for future policy. Our concerns came down to two overarching questions. How will the New York State certification process affect current and future doulas' ability to practice? And how is community engagement handled during the legislative process? Firstly, how will doulas obviously practice under this new legislation? As the bill currently stands, it presents little information on how they'll be able to work. The New York State certification process might become redundant for previously certified doulas who have been certified under other certifying bodies and have already done the necessary trainings and examinations that allow them to do the work that they do. It also doesn't have specific language surrounding volunteer and community-based doulas. And further, how will this affect non-certified doulas? Because a doula, by definition, provides emotional, physical support in a non-medical, non-clinical fashion. And so many doulas don't actually have certification because they are there to provide support. It doesn't necessarily mean that you need to be certified in order to do so. So what does this mean for people who act as doulas without the certification? And additionally, how will New York State hospitals respond to this legislation is also unclear. Will they be able to turn away doulas not certified by the state? The doula workforce would then be limited because where they serve is often affected by people in the community and the hospitals that are in the community available to their community members. And so this, if doulas are not allowed to serve in New York State hospitals because they require the New York State certification, this could deeply affect both doulas and families because it decenters the patient-centered and family-centered model of care. And it also affects patient autonomy. They can't choose where and when they'd like to deliver or receive service because their doula isn't allowed in the room. Their doula isn't allowed to help them make the decisions that they need to do in order to have a safe and healthy delivery or a safe and healthy child. Further, how will this affect marginalized doulas, especially Black and brown ones and undocumented ones? State involvement and regulations have historically provided additional barriers to non-white, non-citizen, and low-income doulas. Which also brings me to my next point, the $40 application fee and ongoing potential fees regarding certification or examination, etc. Those might prevent doulas, especially community-based doulas who often come from the same communities that they serve and can often be low-income as well. That fees and those potential fees could be cost prohibitive. And finally, the good moral character stipulation is also a concern of ours. What exactly does that mean, and how does New York State intend to define such good moral character? What comes to mind when we talk about good moral character is often those with histories of incarceration. Doulas who would be able to do extremely capable and wonderful work might be prevented from being able to do so because of their histories of incarceration or their, quote, lack of good moral character. So secondly, how was community engagement handled in this process? Many of us in this room, many doulas across the state, many birth workers just in general had no idea about this legislation until it was being passed or afterwards, which seemed to signal to us that there wasn't a lot of input from the community, which, from what I have understood about the legislative process, is a critical part in creating legislation that affects communities. You need community buy-in and community engagement in order to serve the community best. So with these concerns in mind, we came up with some suggestions for future legislation. It is important that this legislation clearly define the role of a doula and their scope of work, which is often broad and doesn't really have limitations because they're there to support a person emotionally and physically in whichever way they need. This certification also should not lay claim to the term certified doula. That term is already in use by those who are certified by other certifying bodies, and it would be more beneficial to use the words New York State certified doula and distinguish between those certified by the state and those not certified by the state. This should also offer the opportunity to train with already established certifying bodies instead of collecting fees and creating their own certifying process. And in that vein, legislation regarding doula care should take special care to fund Black women-led organizations. After all, Black women are facing the highest and most lethal threat to their bodies in the medical system. And it is only fair that you support Black women who are working to address these issues, as Black women need other Black women, and equity and representation is vital to every single part of this. And so, finally, instead of regulating doulas, the state should focus on ending structural and institutional racism in the medical system. Black women and women of color generally, non-binary persons, trans persons, are often distrusted with their own information about their bodies and their health. Doula care provides care that the medical system does not. But racism's impact on Black women's bodies starts before the doula consult. Changing a healthcare system to reflect racial and gender equity would transform healthcare outcomes for everyone. And so with this in mind, we are going to go to our Q&A.
So I would like to introduce Ms. Denise West, who is the Deputy Executive Director of Brooklyn Perinatal Network, who is going to introduce our wonderful panel for this evening.
Hello. Can you hear me in the back? Before I introduce the panel, let's give a round of applause to Chanel, please, for organizing this. So those that are not from Brooklyn, we welcome you to Brooklyn, part of our panelists. First, I'd like to call, and as I introduce you, I'm going to ask you to come sit up here. New York State Assemblywoman Amy Paulin. Assemblywoman Paulin was elected in New York State Assembly in 2000. She represents the 88th Assembly District, which includes Scarsdale. Can you hear me without this mic? Okay. She represents Scarsdale, Eastchester, Pelham, and parts of New Rochelle and White Plains. Paulin chairs the Assembly Committee on Corporations, Authorities, and Commissions, and serves on the Committee on Rules, Education, and Health. Her legislative agenda includes state government reform, children and family, domestic violence, sex trafficking, healthcare, animal welfare, and preventing gun violence. Assemblyman Paulin sponsored Assembly Bill A.364B in the 2019-2020 legislative session. Welcome to Brooklyn, the borough of all boroughs. Next, we have New York State Assemblywoman Michaelle Solages. Assemblywoman Solages was elected to the New York State Assembly in 2012. She represents the 22nd District, which includes Elmont, Valley Stream, Floral Park, Bella Rose, Terrace, and sections of Franklin Square. She was the first person of Haitian descent to be elected into the New York State Legislature and was recently appointed to the chair for the Task Force of New Americans. Solange currently serves as first vice chair to the New York State Black, Puerto Rican, Hispanic, and Asian Legislative Caucus. Assemblyman Solange co-sponsored Assembly Bill A.364B in the 2019-2020 legislative session. Thank you. And for those that know about Brooklyn politics, you also know that she took Italia Gracio from the borough president's office, who is here. Now we have our very own New York State Senator Velmanette Montgomery. Oh, you're not gonna be
just in the audience today.
Okay, so she's not on the panel, but I'm gonna read her bio anyway. Because that was the instructions that I was given. And it's on occasion that I follow all the rules. Senator Montgomery was elected to New York State Senate in 1984. She represents District 25, which includes Fort Greene, Boerum Hill, Red Hook, Bed-Stuy, Sunset Park, Gowanus, and Park Slope. Senator Montgomery is the chair of the Senate Committee on Children and Families and was recently elected Majority Conference Secretary. She's also a member of the Senate Committee on Crime Victims, Crime and Correction, and authored a law that prohibits the shackling of a pregnant woman in prison while being transported in the hospital and during delivery of the baby. So with that, you've seen some of the recommendations. Chanel did not call you here to be quiet. Raise your questions, raise your concerns. You have those that sponsored the bill, so if you don't raise it, then it will be on you, not on them. Thank you.
So thank you both for joining us this evening in a community conversation around the recent passage of the bills for doula certification in Senate and Assembly. So, really I must say that the doula community was totally kind of taken aback by the bills, and it caused a lot of conversation, a lot of frenzy around what does this mean for us to be able to do our work and just have autonomy over the work that we do and how we serve individuals within the community. And so I guess my first question would be for you all is, how did the bill even come into fruition to get to this point?
So, and let me also give a little bit of background. I do want to comment on the recommendations that were put forward. I don't know if this would be the right time, but I think it's all mixed together. So, in New York State, and let me step back. Obviously, the issue of maternal mortality and the impact, particularly on the Black and Brown community, has become much more in the news. And I would say probably in the last 2 years, we have all seen, you've all known, but we've all seen, those of us who are not providing services, the disparity and across income levels, right? So that was something that I began to read about and understood from, again, news stories pretty much, but also, I have 3 children from my own birth experience, that, alternative ways of thinking about birth are sometimes, the best ways to think about it. And, the support we are given and the knowledge we have as women allow us to make better healthcare outcomes. And, I can just tell you from my own experience, I had midwives for all 3 of my births, and 2 of them were at home. If I had known more, I would have had all 3 at home. But the first one, I didn't know as much as I learned in that process. So, I appreciate the strength that you give women for them, therefore, to make those kinds of decisions that I made, and to make better decisions for their own birth outcomes. Having said that, in New York State, the way we elevate a profession, which was really what was in the back of my mind, a way to give doulas the ability to elevate in the eyes of New York State, so therefore to try to promote the profession, was to follow the same path that we have done with all professions, which is the first step certification, the second step licensure, which leads to the ability to get essentially reimbursement both from private insurers and from Medicaid. I am assuming, maybe falsely, that that there is very little private reimbursement from insurers. I'm looking, I guess, for a shaking of the heads. Right? I mean, you don't, and a lot of that, usually private insurers follow Medicaid insurers. And you, as a profession, are not eligible for Medicaid reimbursement because the federal government essentially precludes anybody, unless you're a licensed healthcare provider, from getting that reimbursement. So there are 4 states, to my knowledge, that have taken any steps toward Medicaid reimbursement. 2, Oregon and Minnesota, have taken the step of registering doulas and then allowing them to get reimbursement through a licensed healthcare provider, a physician, who would then reimburse the doula. That's the way they're structured. They charge for that registration between $200 and $800 per doula. In those respective 2 states. And the other 2 states that are following that same path of registration, and then consequently, again, the only ability to get a federal reimbursement would be through another licensed healthcare provider. The other 2 states that are following along those same lines are Rhode Island and Massachusetts. When we looked at that model, we, thought it was too expensive for us to do. Oregon in particular has a separate course that they have developed, which is $800 to become a doula in Oregon under that model. So we thought, the more traditional, or the model that we would attempt in New York was the model that we used when we were thinking about midwives 30 years ago, which was to certify and then try and license doulas independently so that they could operate independently of a physician or other licensed healthcare provider. So 1, it would be cheaper, the $40, and 2, would be able to give doulas in New York an independent way of getting Medicaid reimbursement. So that was why we went this way, as opposed to the model that I received just a couple of days ago or yesterday, which is this more similar model to the way Massachusetts, to the way Minnesota and Oregon did. It was too expensive, we thought, and also could only be reimbursed through a licensed healthcare provider. So I don't, there may be a reason, and I'm interested in hearing it, why that might be a good way of doing something else or achieving something else. But my understanding is from, and it seems to me, there are a lot of doula organizations. And I don't know if there's uniformity in the way you're thinking about it, but I think it's terrific and important for you to collectively talk to each other because, as a legislator, it's very difficult when everybody has a different opinion, and it's difficult to know what the really appropriate next step is because I am not you, right? So I need to hear, almost a collective voice and understand, what it is the doula community wants going forward. Because we can abandon this bill. We can take elements of this bill. And I think it's just amazing that, that it's, you're here all together. So I'm looking forward to hearing more from you. But I wanted to give you that background and how we got to the point where we're at.
And just supporting what she is saying, the racial disparity in medicine is real, and I experienced it myself. I have a 9-month-old baby, and my doctor didn't listen to me when I had my first child. I told him I was in pain. And for the point of brevity, I don't want to go into the whole birthing story, but it was horrible. And this story is duplicated over and over and over again. And it's not because you're a low income. It's just because it's the color of your skin.
Could you lift
So-
your mic?
Oh.
Thank you, sorry.
It sort of bounce.
Yeah, I know. Yeah. So we need to change that paradigm. And so for my entire career, I have been working with great legislators like Amy Paulin, ensuring that we, and Senator Montgomery, who's really, you need to give her a round of applause. She's like the godmother, really, of the caucus, guiding light. Working with individuals, ensuring that we bring maternal mortality, morbidity, and child pregnancy-related issues to the forefront. And we are at that stage in the legislative process. When I came in 2012, how many, maternal pregnancy bills have we done? Very, very little. And so now we're at a point where we can have these conversations. And I've kind of been through this kind of what we're doing right now, this discussion. I was a lead sponsor when it comes to having donor breast milk reimbursed on Medicaid and private insurance. And the process went, we had to go and ensure that the state would cover donor breast milk for preemies, and the state had to take a share, and then we were able to move on and do private insurance. And so when we had that successful win, legislative win, I decided, hey, let's go on to doula care. So I'm the one who has a bill to have Medicaid reimbursement and private insurance reimbursement for doula care. And it's necessary, because as I said before, our healthcare system is broken, and we need to fix it together. And so I sponsored this bill because I want to make sure that we have solidarity when it comes to this issue. Because there are a lot of people who don't want to talk about, our maternal health issues. They don't want to respond to it. They don't think it's an issue. They think that we're lying, that Black women are dying every day, that Hispanic women, Latino women are dying every day. They think it's not true. It's crazy, right? And so I thank you all for coming here collectively and having a conversation. Let's have an airing, let's have a conversation, a nice one, we're here. A conversation, but really we're here to get something done, to better your profession, to legitimize your profession. Because I know that there's other people in state government who think that doula care is just, a bunch of hippies, don't shoot me, right? But that's what they think. They think that it's not a legitimate profession. And they're wrong, totally, utterly wrong. And so we need to work together to change that paradigm. So I thank you, and I look forward to the conversation.
So I just want to thank you both for applying context to the conversation to really give everyone a framework around the intentionality of really trying to secure the professionalization of doulas in supporting birthing people within the state of New York. I do want to bring up some context, though, in regards to the framework around comparing midwifery and doulas, right? In terms of, how the model and the licensure of midwives within New York State disenfranchised a whole group of other midwives who were no longer able to practice within their respective state. because of the unintentional consequences of the bill. And in seeking out, legislation that is going to uplift certain communities, I think it's really important that community voices and experts and stakeholders within those communities have a vested conversation within the development of those bills, right? To ensure that there are no unintentional consequences to those things. And so in regards to Rhode Island and Massachusetts, yes, I'm fully aware that they have 2 bills that are currently in the process of, being organized. And I know that a lot of the templates have been around Minnesota and Oregon, which is really problematic in a sense because they have a lot of caveats that came up that have prevented doulas from actually getting the reimbursement through a physician, late reimbursement or just no reimbursement at all. Just really wanting to look at the framework of, if we're using Black women and we're using people of color as the foundation of a bill and the creation of bills, we really want to think about the impact that will have on the Black people and the Black women who are actually serving those communities, which happen to be most oftentimes community-based organizations, right? If the intentionality is to really uplift the profession and those who are serving those particular populations of individuals, I would think that those people would have been invited to the conversation, right? In regards to really shaping the framework of what that looks like. And so I just wanted to just put that out there. In the creation of the doula pilot program, Ancient Song, Every Mother Counts, Brooklyn Perinatal Network, and other organizations were really involved in the processes, and it didn't come into fruition because it wasn't an equitable model. Right? It wasn't doulas within Kings County said, no, I'm not doing this because this is not equitable, right? It doesn't serve the people and it doesn't serve the doulas who would be providing the services. And so that's why no one signed up.
You mean the pilot?
The pilot, right? So the pilot that's currently in fruition. And, we gave robust recommendations around, thinking about organizational structures where organizations become the clearinghouses for doulas who would like to be able to reimburse through Medicaid doula reimbursement. We do know that there's a facility fee that comes with a Medicaid when a center or a clinic is accepting Medicaid patients. And so that was completely shot down. They were like, no, we're not doing that. We're going to do individual payers, which becomes problematic, right? Because then we lack accountability measures to the patient as well as to the doula and being able to sustain themselves in the work that they're doing. Doulas are undervalued for the amount of time and energy in which they serve a family or an individual in the work that they're doing. Sometimes it's 45 plus hours or more in that context. And so, saying that there's not enough financial backing to be able to support the backbone of which is I think the foundation of starting institutional reform and accountability for patients to be able to have better birth outcomes, but not just better birth outcomes, but better birth experiences, to me is not an adequate response. In terms of being able, especially with these beautiful people who are out here who are giving themselves and their time and their energy every single day. And so I really I just wanted to lift that up and just put that out there. And yes, we sent out recommendations in regards to what doulas, private as well as community-based doulas could look like in order to have an equitable model, and why we really wanted to have everybody in the room. I'm not going to continue to talk. What I really want to do is I want to hear your voices and I want you to ask questions directly. And so if anyone has any questions, we can start. You can just stand up and we'll bring the mic to you.
Hello, thank you for being with us here today. My name is Lucia. I live in Brooklyn. I'm a full spectrum doula. That includes abortion, birth, and postpartum care. I wanted to ask, who did you speak to when making this bill? Because if the people in this room didn't know about it while it was being formed, that gives me a lot of concern and a lot of pause. Were there talks like this? Did you have community outreach in any way? Who did you speak to form this bill? Thank you.
Well, the staff member for me who formed the bill had extensive healthcare background. I can't say that she spoke to any specific group. I don't know whether she did or she didn't, honestly. But the model that we used is the same model that's used for every other healthcare profession in the state of New York, and frankly in most states across the country. So it's not, this is the model that's used to start the process of elevating a profession. So it's the baby step. Certification is the baby step. Licensure is the next. But there would be. So the question is, does the profession or does the doula profession as a profession want to be recognized by the state, or don't they? And so the conversation is now. I think if we had said or forget the bill for a minute, if I said to any of you, do you want to elevate your profession? The answer is yes, right? So then the question, you don't want to elevate. You don't want to be recognized by the state.
If the medical system, if the medical system is broken, and that's what's been said, right? So if the medical system is broken, why would we use the same process to certify us if we're in there to fix it?
Wait, hold on, let me. So I want to just make sure that there's clarity in the conversation, right? Now, if we're talking about doula Medicaid reimbursement, or we're talking about reimbursement for services that are rendered through private insurance payers, then yes, do doulas want to accept payments? Of course we do, right? For instance, Ancient Song Doula Services, about 85 to 95% of the people who walk through our door are Medicaid recipients. If we were able to bill the patients that we see, it would help to sustain the organization. It would help to facilitate payer reimbursement to the doulas that we have that serve clients every day. It would help in terms of sustainability. But what people don't want is a blanket, right? A blanket bill that would hinder the private or independent doula or the lay doula from being able to practice in a way where they no longer have autonomy over themselves and the work that they do, right? So there's a big difference, and I think that has to be pointed out, between the community-based doula model and the private doula model, right? Because when you start to lump both of those models in as one, that's where the problem comes in, and that's where all the pushback comes in at, because then the individuals who are practicing and have their own individual practices would no longer be able to do that in a way that serves themselves and or the communities that they want to serve. Is that clear? Is that good? Am I saying that right, y'all?
Although one of the things you have to understand is there's no requirement. Nobody's saying you have to get Medicaid reimbursed. No one is saying you have to be certified by the state. We could leave here today and this bill could be enacted and nothing changes. Nothing changes for an individual doula.
So let me give you some context. I'm really big into breastfeeding and nursing and human breast milk. Kind of weird, but I love it. And so I know that there's an issue right now when it comes to certification of different types of lactation consultants. And where the problem arises is the Department of Health. So we as legislators cannot legislate every single point of a bill. It would it would drive us crazy. I would not have to dye my hair. But what we have to do also is educate the individual, like the Department of Health, as to what doulas do, and also educate the governor's office as well. And so I'm hearing I'm having like flashbacks. I'm hearing some of the concerns that you have regarding certification. And if you want to go down that aisle, we can have that conversation. But at the end of the day, we still must educate the Department of Health with our concerns, because the pilot program is failing because we are not educating the Department of Health. I know you did, yeah. But we need to reform. We can't just say, hey, let's forget about it. We have to have a conversation with them and educate them and tell them what we need to do. I know that you guys did what you need to do, and it's great, but I want to go back to the drawing board when it comes to the pilot. I want to go back to the drawing board when it comes to this bill, if you want to go that route, because we really need to educate.
So I will say, in terms of education, Ancient Song has spent the last 2 years since the development and the conversation about pushing, educating New York State Department of Health on the role of the doula, differentiating the difference between doulas. We came out with a report, a robust report that is actually being used by Minnesota, Rhode Island, and actually there's right now nationwide there are 15 doula bills in terms of legislation in Medicaid doula reimbursement. And they're using the report that we created with Every Mother Counts to inform the work that they're doing in Village Birth International. So it's not like the education is not out there, it's that people are not listening to people when they speak. It's like talking to the brick wall. And so it really has to, it can't be about just education. It has to be about institutional reform and accountability, where individuals are taking responsibility for the fact that you're not listening to community when we come up and we say, this is what needs to change.
No, I understand what you're saying. The problem is, we do not, control the Department of Health, right? Okay. So, I want to throw it back to you. You put a valid effort into trying to do that in order to make the pilot program work, and it didn't work, right? So now they said, okay, so we're not going to give you Medicaid money.
It's not that it didn't work. It's that they didn't listen to the recommendations that were provided.
But in the meantime, now there's no Medicaid money.
Right. Well, no, there's Medicaid money, but it's now Medicaid money in Kings County because, and this is, I just want to make sure that it's very, very clear that, because I knew that the conversation would turn back to doulas did not want this. No. I'm not saying that you all are saying that. I'm saying that the conversation would be that doulas, they didn't want this, or it's because of the doulas that the pilot is not working. No, that's not the case. But doulas are not going to sign on to something that's not equitable for them and the communities that they serve. And so in keeping with that, I just want to make sure that is like really, really clear that the models that were presented were very robust. They're models that are evidence-based. They are models that have proven to work in terms of policy and reform, and still it fell on deaf ears and people decided to use the frameworks that they wanted to use. That is why it's not working. It's not working because they chose not to listen to community and people who do the work every single day, right? Also, I think that yes, Senator Montgomery.
I just wanted to make a couple of comments, and especially to the young lady. I think that it's important to note that the governor, because of the work that's been done here by Ancient Song, by Brooklyn Perinatal, and for a number of years you've been raising the issue of the drastic problem of a prenatal and natal, the problems with low birth weight, with the death of babies, with the death of mothers around childbirth. So the governor came up with this pilot. So that wasn't us, that was the governor. And the difference is that the Department of Health is now using Medicaid funds to fund those pilots. What the bill attempts to do is create an opportunity, a pathway for us to fund all of you through the Medicaid process. That requires the state to take certain steps as it relates to establishing that kind of program. So what the bill attempts to do, and by the way, the bill has passed both the Senate and the Assembly. So it is now up to the governor to either sign the bill or veto it. So that's what we're actually talking about here today, so I want everybody to understand. So you're talking to the legislators who are trying to do something, but if this is a problem, the next step for you is the governor, because he will either veto it based on your objections, or he will sign the bill, and we'll have the elements of this bill come into being in 90 days after he signs it. So, but the pilot idea came from him, and this is an attempt to address the issues raised around maternal health in the state of New York.
Yes. Yeah, so one of the things I wanted to ask is the state reimbursement. I mean, one of the issues was it was too low, right? And part of the reason it's too low is because they couldn't use federal, they couldn't, you know, in New York it's 50-50, you know, federal Medicaid, Medicaid and reimbursement is 50% federal, 50% state. Because this isn't a federally, it doesn't fit the federal requirements because you're not a licensed profession, it's only state money. So what we were trying to do with this bill was trying to create a process so that it would be, the state could get 50% from the federal government. So whatever they were offering would be doubled, essentially. Now I don't even know if that's enough, but that's really, you know, this is the first step in trying to achieve not only individual reimbursement for a doula, so that it wouldn't be based on some pilot, but it could be the Queens doula or the Manhattan doula or the Bronx doula as well. But it also was trying to create a process whereby we could get federal reimbursement. Now, we could try the method you're suggesting in your alternative. I'm not saying that we, you know, and we could try to be creative in the way we define stuff. Like, I get the word certification is an issue. I get it. You know, you guys are certified. You've been using that term for a long time. There may be things that we can do, but if we can at least agree on the goal, like if the goal is, I think what I'm hearing, and tell me if I'm not hearing it right, the goal is a good Medicaid reimbursement number, individual reimbursement so that you're not dependent on a pilot, and to be able to get there without having to use another licensed Medicaid provider to get it for you. I mean, that's the goal, right?
So yes, so the goal, yes, is to be reimbursed. Yes, doulas would like to be reimbursed for the work that they do.
And private insurance.
And private insurance, yes, that without a doubt. But
Also not defining what you are doing.
right, so just making it clear, because as the bill stands right now, it's open to interpretation, right? It could cause, like, a doula could go into a hospital institution, and the institution could now say, oh, well, are you a New York State certified doula? Oh, well, if you're not, I'm sorry, we can't allow you to come into this institution and to serve any of the clients. Which would thereby take autonomy away from the doula. It would take autonomy from the patient being able to choose who they have by their side, and really cause a problem within the system of the way in which the doula navigates and works. And so the biggest overarching issue is that the bill is not clearly defined and is not laid out. It doesn't differentiate between private doulas. It doesn't differentiate between community-based doulas who are doing community-based doula work, so that in the term a certified doula, right? And so it's not that the doula community is saying, oh, we just don't want this at all. It's saying that we want something better. No, and what we have right now is not what it is.
I think we can get there. I think that if we have the goals are the same, and we need to obviously work together to get the right words and the right language. But if the ultimate goal, as I'm seeing with the shaking of the heads, is individual reimbursement at a better level, which is, in order to maximize that, frankly, it's federal dollars, or if we can't, because we do not want to impose those same federal requirements, which is the licensed Medicaid provider. It's legislators advocating to the state that we're going to use state money but at a better level, so that we could advance doulas in New York State. I think that we have to look at both ideas. But that's a different bill from this. So look, I said on the phone call, I think many of you were on that phone call, we could either, if we can do it in time, work toward, I don't expect, because this is controversial now, I don't expect the governor calling for the bill until December. That's when he calls for controversial bills, because he's going to want to veto them. And he's not going to want to support a bill that's of mixed mind in the community it's intending to serve. So either we try to work toward what we would call in our business a chapter amendment, which is really a relook and a rewrite of the bill by December, or if we don't do it in time, we let the bill get vetoed and we bring it forth in January. It's easier to negotiate, frankly, if we do it in the form of a chapter amendment, then we have all parties involved. But if we can't get there, we can't get there. I'm not suggesting that, I don't know. I mean, I think that to the extent that you guys stay coordinated and stay, keep the communication together with us, we can get there perhaps. But if we can't, we can't, and then we take it into when we can. It's a process.
So hi. So I have a question and a comment. Did she speak for you?
Yeah.
I'm sorry. So my name is Tatiana Smith. I'm a full spectrum doula. I'm based in Jersey City, but I do serve women in New York. My first is a question, and then I have a comment. So if I heard correctly, you said that the legislators were using a model of midwifery certification from 30 years ago?
No, all licensed professionals. Not even just in the healthcare arena. Primarily, but we're talking about like licensed veterinarians, like every single healthcare provider, nurse practitioners, nurse anesthetists, all of them start with what we call a title bill, which is the certification bill, which is this.
Okay,
so it's not just I just said
about
midwives.
30 years ago, midwife, and
doulas
aren't midwives.
No, I get it. I just use them as
distinction.
an example, but they're not. It's the model that's used for every healthcare profession in New York State, not just midwives. It's across the board.
Okay, because there is a big delta between what you did 30 years ago and what we are doing in the community right now. So I just want to make sure that the legislators understand that distinction. My second comment is that I take a real offense to the tone that I hear that doulas, the doulas in this room and the doulas that are serving our communities, that we're somehow ungrateful. And not that you said that we're ungrateful, but it seems like I'm getting this feeling that like we should take it or leave it. I don't know where, what legislators may think of us rejecting this bill, but it's coming from a place of no one has spoken to us. And I just take real offense to this whole idea of we are not organized or we haven't gotten together. We've been doing this work for I don't know how many decades. We've been meeting in community centers. We've been meeting in our communities. We've been like shouting from the rooftops of what problems we're having in our communities with birth rates. This is not new to us. We've been doing this work. So I take real offense to people saying that, we're somehow not coordinated. We've been doing this. It's just that people aren't listening to us. We've written things.
Not that, I don't, I think the take it or leave it is not so much, or it's not at all take it or leave it. This bill is take it or leave it. That, not you, not me, not us together. It's the legislation. I think that what the senator was saying is where we are in the process of the bill. Nothing to do with any.
So how do we get to a bill when nobody sat with us beforehand to ask what we actually needed? You guys went ahead and made a bill.
I get it, which is why we're here now, to have the conversation. I think that it's better to just sort of go forward than look past. I mean, that's what we're trying to do here. We're trying to work to make it work for you. So what we heard after is that it's not. I get it. It's not. I am okay with that, and I hope you're okay with that. And what we can do though collectively is to say now, okay, we created something that doesn't work. All right, we make mistakes. You know, we're all human. Now let's go forward and make something that does work. And, you know, you have my commitment that I'm in it if you want me to be. You know, if you don't want to do that, then all right, fine. I go home, I go back to Westchester. I grew up in Brooklyn. I'm used to making that trip, you know. But I would rather, you know, work together to try to attempt to make something that works for the community.
I want to, I hear the sister who is feeling a little bit insulted about the process. And obviously we apologize for that. My experience after all of these hundreds of years, that I'm so nervous because I know how hard it is to get a bill done. And we just this year, because we're just now, this is the first session that we've had the power to make something happen in the Senate. It was many years that Assemblywoman Paulin had the bill, and it was in the Assembly, languishing there, I'm sure, waiting for an opportunity. So this year, you had the opportunity because we were in the majority. So that's one thing. And so when the doors opened, the gates opened, bills came flowing through that had been waiting for an opportunity for so many years. So I'm nervous when we say, oh, we don't want that. We just throw that out. So I just want to make that clear. I understand and I hear the frustration, and I think what I would like for the doulas in this room and the women in this room to know is that we're talking about an important part of the health delivery system for women in New York State. And we've been trying to figure it out for years, but without partners in the state Senate. So now we have the partners. And so we are all here. Unfortunately, Senator Ramos could not come. She is the sponsor in the Senate. So she was the one that got the bill passed on the Senate side. She had a doula, I believe, and it was such a great experience, she decided she wanted to make sure she did this bill. So that was what I understand as it relates to our side. But we thank you, and we want to make the changes, but I just wanted you to know what the process is now. It did pass both houses, and I only received your memo expressing your concern after the bill was passed.
Right.
I got you. I hear you. But I just want you to know, on both sides, we're talking to each other. We're in the room together. We can make this work. Yeah. That's one. Two, as I'm reading the bill, it's the same as any other, as the Assemblywoman are saying, it's the same as any other situation. If you are looking to be certified to teach in the city of New York or in the state of New York, it doesn't matter what school you went to. It doesn't matter where in the country you went to school, as long as you have your degree. As long as you are a certified doula, you should be able to practice in the state of New York. But you should also be able to be certified. The Department of Health is being instructed, based on this legislation, to come up with what they view as certification. That is also another opportunity for all of us in this room to weigh in on what the final results will be vis-a-vis the Department of Health. All we're saying as the legislative branch is we want you to look at certification so that when we look to redo or do whatever it is necessary, budget-wise, to include doula in the health reimbursement system, we have a weigh-in from the Department of Health. We have something that tells us you're able to do that because you do have a system of certification in the state of New York. That's all we're asking in this bill. If we need to change, it's not up to me, it's going to be up to Senator Ramos and Assemblywoman Paulin and her staff. But that is essentially what we're doing with this legislation, as I understand it. Not denying anyone to be able to practice. As of this moment, you will never be denied practice, but some of you will not be able to be reimbursed through the Medicaid system, which is what we want, because we want women, especially women of color and women who are not of means, who can't pay for the private paid doulas. We want those women to be able to be served as well. So that's what this is, and I hope we can come to an agreement on the language, on the process, but I hope we don't look to kill the bill that we worked so hard and hoped so long for in the state.
Thank you, Senator Montgomery. Okay, so I just want to, because we're almost out of time, really bring some context, and I know y'all fired up. I get it. But I also we also understand, and I want you all to understand that you're not going to come to a conclusion here tonight. Like, that's not what's going to happen. This is more of an informational session to get you to understand how it even came into fruition and what it is the next steps could possibly be. So I'm going to break down to you what those steps are. There's chapter amendments, as Assemblywoman Paulin and Solange have mentioned. Chapter amendments allow you, this is where we have our listening sessions, this is where we gather information so that we can synthesize recommendations and then present them accordingly so that we can get the bill that we would like to see. The other option is that you can veto the bill, but here's the thing. Please know that because there are other states, about 15, that have doula Medicaid reimbursement and private insurance reimbursement on deck right now, the conversation of licensure and certification by states is going to come up again. This is not going to die because you veto a bill, right? And so you have to be prepared that if you veto a bill, what is going to be your next steps in ensuring that the language that you want to see and the bill development that you want to see, that you're going to actually be intentionally involved in that process, and you're going to be at the head and the forefront of making sure that that language is inclusive and that people are there throughout the whole step of the way. The other option is that it could go on to the governor's desk and he could pay it no mind. And if he pays it no mind, guess what happens? It automatically can become a law. Or it could have the other option is if both Senate and Assembly, because it has already passed, if he vetoes it, but the Senate and Assembly members still feel like, we like this, it's gonna stay the way it is, they can still vote it into law, okay? So the best option that we have at this particular juncture is chapter amendments and being able to see the bill in the language that we want to see while we still have momentum, while people are still energized around really seeing the language and the things that we want to see within the bill creation. Now, I am a doula, so that means that I offer non-judgmental support and information so people can make an informed decision about what it is that they want to do. And so I am not telling you what to do, but I am presenting you with the options of this is what it looks like. And so, if you would like to see chapter amendments, Ancient Song is going to continue to galvanize around having listening sessions throughout the state of New York to gather community experts, information, and conversation from consumers as well, so that it can inform the language of said bill. If you want to veto the bill, please be prepared for the next steps behind that, because you will need that immediately. Not yesterday, not in the future, but right now, okay? And so those are your options. Options are great, right? As doulas, we present options to the people that we serve so that they can make an informed decision that best suits them and the communities in which they serve. I want to give Assemblywomen Paulin and Solange an opportunity to give some closing remarks, and then we're going to collectively close out.
Sorry, I just feel very strongly about
Hi, I'm Ogamdi. I'm a birth doula.
Use the mic.
I'll actually use it. Hi, I'm Ogamdi. I'm a birth and soon-to-be postpartum doula with Care Child's Birth. And I just want to speak into the space before we leave here because I think it needs to be a part of our collective conversations, what the certification process means for First Nations doulas and clients, for trans and queer and non-conforming doulas and clients, and particularly for undocumented clients as well. If we want to think in undocumented doulas, if we want to think about New York as a sanctuary state, and that public hospitals, particularly such as the public hospitals in Kings County, are places of sanctuary, then we really need to be critical about what support you will offer at that location, at these particular places where even putting your name down is a dangerous act. I think that when we're talking about disparity, we are also talking about the fact that queer folks, trans folks do not walk into hospitals ever for anything. Queer folks, trans folks give birth. We do not have to be women to give birth. If we want to be women to give birth, great. But I think that our language also needs to represent the fact that we are not only going to be having a fight against, okay, how do we allow people, how do we allow women, how do we allow Black women, brown women to be more comfortable entering into the birth process. It's also to say that whenever you try to establish some sort of support or any form of state-mandated organized support for marginalized bodies, there are other marginalized bodies that become further marginalized. So I really would hope that we take into these conversations the ways that we need to set up those micro supports and that need to be considered in the language of this bill.
The way that hospitals respond very hostile to doulas. I don't think we're talking about medical professionals. We are not medical professionals. We are not healthcare professionals. We are support professionals for the person that is hiring us. When we are in these hospitals, we get kicked out. We get doctors yelling at us. We get nurses yelling at us. We don't have any support in these hospitals. So this bill is not supporting the hospital staff, supporting the medical staff to continue to be hostile to us, because then they can say, well, you are state mandated, you need to be of this moral character, you are not following, I will report you. And this is how we got our midwives out in the first place. We're saying that Medicaid is not, we're trying to say, compared to midwives and being insurance-wise, midwives are not accepting Medicaid in New York City because it does not pay a living wage. Medicaid pays $1,800 to a midwife who paid over $100,000 for her education. We're not even considering like the roles that we play. Even that how, living wages. Yeah, and so for me, it's very much in this space of, yes, we want to serve the communities that can't reach those of us who are asking for $1,500 or $2,000, but my rent is $2,350. My rent is $2,350, my groceries is as much, MTA is constantly going up, we don't have public transportation, we live in food deserts. We are asking for things that we want to have a sustainable life, and we have, as a community, have made our life sustainable without you. And so if you are going to come in and make our lives unsustainable, this is a place where you listen to community and say, how do we make this better for you? Not how do we make this worse for you? Because this is what this is seeming like. It's seeming like community is not being able to respond because it's already passed Assembly and bill, and now we have to just get in what you want. And it needs to be reversed. Because if it's not reversed, we veto and we will rise up.
No, it is.
And also, before you guys, close out, I want to turn Chanel's question to you guys, because you guys are receiving this opposition, you're receiving these memos, you're taking all of this in, and what do you guys plan to do to come back to us and get our input? You said
we're here.
I mean, you're here, but what do you do next? What do you do after you go back to Westchester? What do you do
You know what?
when the person...
I have to say, I feel a little offended, I have to say. I wouldn't be here if I did not want to listen and work with you, right? I mean, but I didn't have to come.
You could have come earlier.
Well, I wasn't invited until tonight.
Well, I mean, in the same way,
all right.
Chapter amendments are going to happen, and we'd like to know, what are your next steps? You said you made the bill
chapter
without
amendments
doing all
do
of
not
the
have to
research?
happen. We could let the bill get vetoed, and then it's dead, and then you're back to where you were. Or we could work together to try to make an improvement. I
So
mean,
what
those are the two
what are
options.
your plans to continue to work with us? I mean, I don't know if you guys are familiar with.
So I want to say before, because I understand that emotions are running high and that this is not an attack against one or the other. It's more about, we have to understand the complexities, one, of systemic oppression, of institutional governing bodies, and how policy works, right? And so unfortunately, yes, we find ourselves in this position in which now we have to make certain decisions and certain moves. So now it's more about moving that energy forward so that we can find actionable steps, so that we can get the language and or the information that we want to see in a bill. Because again, we have options. We can do chapter amendments, or we could it could be vetoed. And if the chapter amendments are done, then that's us collectively coming together and us doing the listening sessions and gathering the information. Or it's vetoed and you still got to gather the information and you still have to think about another bill because it's going to come up again. I hope you understand what I'm just saying to you. That it's not going to die because a veto happens. Once you start to take state and federal dollars, there are going to be regulatory bodies that are going to want to govern how those state and federal dollars are received and how they're being distributed throughout varying different communities. And so in understanding that the policy and the politics of it, we have to collectively come together and make a decision that don't have nothing to do with them. That has to do with us and how we want to move forward. All right, I want to give you all the opportunity to.
I've talked a lot. I'm good.
Senator Paulin and Solange, I just wanted to thank you. Over here. I really do think that you guys had your best interests at heart when you did this. However, I think there's a perception that everyone wants to be a quote unquote professional. If anything, I look at myself as an artist, okay? And I like the freedom of an artist so that I could serve people the way that they need to be served. And so my concern with this bill is that I'm not going to be able to do that freely. I'm going to turn into a robot. It's going to be another profession that looks a certain particular way, and that does not work for every mom. So that's the big thing. That's the huge scary thing. So can we find a way to serve the persons of color through the community doula organizations without impacting everyone?
Got it.
Right? Without killing it for everyone. Because ultimately the big picture is that we're affecting the moms, we're affecting the families, we're affecting the communities. There's a lot of passion in this room because, of course, it's affecting us, but the bigger picture is the moms.
Understood.
The bigger picture is the people.
Look, if we can't get there, we won't. But if we can, we can try together. That's all that we can do. We can just try together to get to exactly what you're pointing out.
And I just want to thank everyone because I learned so much just hearing from you. The full spectrum doulas, just different terms that I've never known before. So I just really want to thank you. And just a recommendation. Within each one of your organizations, you need to have a government relations individual. An individual devoted to seeing what's going on within the legislative process. Not saying that you don't have that. Hey, come on.
Chanel is right here.
Not saying that you have that, but there's our individuals. I'm not speaking to the whole masses. I'm speaking to some of the people who are there, who are silent right now. Because what happened with this bill, I was only notified the day the bill was on the floor. And that's a problem. But with every doula bill, I only have so much of your emails. And I can only contact so many individuals. But we as a collective have to ensure that we hold government accountable. So all I'm recommending, nothing, I don't want to be demeaning, I don't want to offend anyone who already knows this information. Please, I apologize if I do. But we need to make sure that we hold government accountable. Because there's going to be bills that maybe we won't have, that are going to come up, that we need to oppose together. And we're working together. We're not here as adversaries. We're here together collectively. And we want to work with you. And I know for myself especially, I want to work with you. I want to be there with you. So let's work together. You know, my mother always says there's a mal pour bien, and that's a French term. Sometimes something bad has to happen in order for something good to happen. And so today I think that we had something great happen in this room. that we got to know each other, we got to network. So let's get it done, and let's see what we can do to improve on the situation or advocate for doulas. It's all about making sure
I would also
we
like to
advocate for
add
you.
the point that in order for all of us to work together, we have to hold one another accountable. And we are holding you accountable today. You have taken this time to not hear our concerns by continuing to say that you're working with us and defending what has brought you to this point while not listening to the point that you never took into consideration our voices when this bill was written. I'm hearing you, Representative Paulin, say that this will elevate us in order to be considered by the state
No, I
legitimate.
said that was the goal. I didn't say it does.
Right.
Okay.
Well, I want to know from you then, because for some of us, as you saw many of us in the room shaking our heads as you said that, being state certified, we do not believe that that elevates us. And for you to insist that that is the only way, you are totally denying and not taking into consideration some of the points that we have put for you, which are on the slide right behind you. I want to know from you that if for those of us who choose not to become state certified, perhaps because we consider it would not be an ideal education when we have other opportunities previously existing to be certified through organizations or through mentorship or through the guidance of our own ancestors for the knowledge that we have had for centuries about how to do our work. And we believe that those spaces are more enriching and will elevate us far more than state certification ever could. And I want to know from you that if this bill did go to a chapter amendment and these things behind you were taken into consideration and that it prioritized and preserved opportunities to train with established certifying bodies instead of collecting fees, instead of imposing new barriers to access for us to practice, what would elevating doulas look like for you? How will you elevate doulas if not having them state certified?
I'm sorry I used that word because the intent was so that the common agreement that we did reach, which is so to allow individual doulas to get Medicaid reimbursement if they so choose to do that, was the better way of phrasing it. So that's really the intent behind the initiative. The intent behind the initiative is to be able to have doulas get their the proper reimbursement so that they can, so that we can have more people wanting to go into the profession. So it's not, so elevating the profession is the wrong term. It's to enable New York State to be a facilitator so that we can provide the resources to have more doulas enter into the profession. And that's really, what I meant, and I should not have used, elevating, because you are elevated. I get it. You are already serving the community.
To be elevated.
No.
You are not the only one. As was spoken, that we work in hostile environments. The work that we do is undervalued, not only financially, but culturally.
I
and that
understand
is an
that.
ongoing effect of the genocide of our people and our cultural knowledge.
Just like, I forget who said it, it might have, I remember it was the beginning of this, but that people have this image of hippies with long skirts, and that's the image, frankly, that, no, I understand. So I understand. So that the image is a bad image, right? And that's not the image that we want to put forward in order to encourage, not elevate, to encourage the profession.
Right. And,
Here, use the mic.
I would like to just take this opportunity. This is my district. I represent this area. So I want to take this opportunity to welcome you again, both of you. And I want to say to the people in this room, let me just say to you in no uncertain terms, I'm a little bit uneasy watching these women be attacked for successfully addressing something that is very, very important to all of us, even though they didn't do it exactly like we would necessarily want it to be done. You have tried, and I want to thank you. She comes from Westchester County. She doesn't have to be in Brooklyn today. This woman,
All right, I'll go.
this woman,
I'll go.
this elected official
I'll go.
has a 9-month-old baby, which was born during session. She was pregnant half of the session, and she still came and worked on behalf of her constituents and women in this state. So I just want to personally thank you, because I know how hard it is to be in your position, in our position, and it is very, very important, however, that you're there, because at least you came to Brooklyn to listen to people in this room, and I appreciate that, and I thank the people in this room. I thank you for making your voices heard, but please, we're not working against you, we work for you, and I want you to know that we appreciate the fact that you did come all of that way to address this issue, and we look forward to continuing this dialogue and to work until we get it right.
We're going to
We must
try.
do
I'll
this.
go.
We don't get there, but we're going to try.
I'll go.
Thank you.
All right, give thanks. I want to give thanks, one, for the energy and for you all coming forward and presenting your questions and having an opportunity in which to state your distrust in understanding why we distrust systems, in understanding how birthing people and people of color are not honored within their work. I want to put out there to you all that ancient song is going to our next steps and what we are doing to ensure that we collect your narratives and that your voice is heard, is that this session is going to be made available online so that you can go and it can be shared. We are also going to have an online forum to collect your responses. We are going to continue to organize throughout the state of New York. I am going to DC tomorrow, but I will be in Syracuse on Saturday, and then we are going to Beacon, and we have to go to other places throughout the state to continue the conversation. This is not the end. This is just the beginning. I ask you all that if you have a specific narrative that you would like to share, to write it down and to send it to us in letter form so that we can send it to the assembly persons so that they have your statement on record, okay? So that it can, and then we can hold people accountable for the things that they do or they do not do in a way that is equitable, right? Where we both parties' voices are heard and no one feels attacked in any kind of way. Again, in closing out, I thank you all for your time, for your energy, for being present, and know that this is just the beginning, this is not the end, and that we have all of your information out front. If you registered and got a ticket, if you did not, please make sure that you see people at the desk before you leave so that we can collect all that information so that we can make sure that we can inform bills and legislation that we want to see that best serves us and the populations that we want to serve in a way that looks good for us. Again, I thank you.